Malabo, capital of Equatorial Guinea. There is in the city, as in all the country, a sustained dynamic towards development. Infrastructure came out of the ground at an impressive pace. In this country, long considered as an El Dorado, men have conquered and built living spaces. The equatorial forest opened to highways connecting cities, regions, and leading to neighboring countries. Equatorial Guinea has set the scene for its future, and it is certainly this determination to move forward that has helped to cope with the global oil crisis, the country's primary source of income. The international community, confronted with a multitude of constraints and with multiple requests, applied itself to ward off emergencies around the world. Multilateral and bilateral actors, recognized as donors of development programs in Africa, could not in turn take up all the challenges to be met. Talking of challenges, Equatorial Guinea has to meet some, especially in the field of health.
Guinea Ecuatorial cuenta con una política sanitaria.
Equatorial Guinea has a health policy whose aim is to improve the health of the population in an equitable manner, with means capable of bringing the death rate and handicaps to the lowest level. As part of the implementation of this national policy, it was approved in 2017 a national plan for economic and social development by 2020 that includes specific health objectives, which are to improve the organization and mechanisms of coordination and management of the national health system, improve the supply, demand, access and quality of health services accessible to the entire population, improve the health of mothers, women, children and adolescents, strengthen the fight against endemic diseases, malaria, tuberculosis, HIV/AIDS, etc., strengthen the control of chronic diseases, develop the surveillance system, and provide answers.
It is a universal truth. Health has no price, but it has a cost. Malabo is facing the drop in oil prices, and this has a considerable impact on its means of financing. In this context, an American oil company, Noble Energy, headquartered in Houston and present in Equatorial Guinea for the past 20 years, expressed its willingness to invest in the development sector to support the government.
Here in Equatorial Guinea, Noble Energy has a quite vast portfolio of social investments. Mainly we work through the Ministry of Mines and Hydrocarbons, and we have about a $2 million annual budget, and we do projects focused on health, education, the environment, and a lot of workforce development training of local communities and local community members. Most of our work right now happens to be on the mainland. We just inaugurated 2 water wells, we're building a park, and we're doing a very interesting study on the feasibility of a business incubation center here in Equatorial Guinea. For Noble, health is a key sector because it affects so many other things. Noble for years has been one of the major investors in the Bioko Island malaria control project, which is involved with malaria control and testing on a very new, exciting vaccine for malaria. So that was our focus even before this project came to our attention. And then Noble, I think in its infinite wisdom, decided that it would invest its own money, and this project is Noble's own investment in trying to reduce the troubling mortality of maternal and neonatal in this country. And so that's what led us to this particular project and this partnership.
In the field of health, Equatorial Guinea has made remarkable efforts to reduce maternal mortality. In fact, in 2015, the country reached MDG 5, the Millennium Development Goal, that recommends the improvement of maternal health. Of course, the American company, which is investing alongside the Equatorial Guinean government to advance in what has now become the Sustainable Development Goals, needs to have a technical partner whose expertise and skills are recognized in that sector. The United Nations Population Fund, the UNFPA, is being asked to act as executing agency for the project for the reduction of maternal and newborn mortality in Equatorial Guinea.
C'est une chose extraordinaire de voir une
It is an extraordinary thing to see a private company that is a little bit interested in the issue of maternal mortality. It is an extraordinary thing to see a private company that is a little bit interested in the issue of maternal mortality, but also which is convinced of its place in the fight against maternal mortality and that this institution can put several $million. This initiative is to be welcomed and encouraged, as it is also an initiative that contributes to the capture of the demographic dividend. As you know, the demographic transition necessarily entails a reduction in maternal and infant mortality, and that is exactly what is involved in this project financed by Noble Energy in Equatorial Guinea, which goes well with beyond the capture of the demographic dividend, the fight against maternal mortality, but it is also a very strong commitment of the private sectors. So for a community activity that affects the most disadvantaged populations in a country like Equatorial Guinea, this partnership came at the right time, and its particularity is that we must focus on two provinces, Bioko, Norte and Ntem, because they have indicators that are below the national average. So we try to put in better conditions by trying to invest in health, especially in maternal and newborn health. This is one aspect to consolidate the gains that the country already has. The second aspect of this collaboration is that it is the first one we try, working with Noble Energy to see what happens in other projects where Noble Energy, where other oil companies are involved. For example, we cannot talk about reducing maternal mortality without trying to see what happens with another malaria project. Because as you know, malaria and pregnant women are a serious problem in this country, especially in this tropical zone.
We are in Bioko, about 30 kilometers from Malabo. The village is starting to take on city dimension. Many residents have responded to the invitation of officials from the Ministry of Health and the Ministry of Information. This is one of the first family planning awareness campaigns.
Con una población de 556 habitantes.
The population is close to 556 inhabitants. We must organize ourselves because here I've noticed that women do not communicate as much as men, and we do a lot of things that are not suitable. For example, we notice that there are children in the village who are hungry, there is a lack of classrooms, there is no medical follow-up, and many other things. There are children who sometimes do not have enough to buy a notebook, and we have to help them. But our program will help us to better manage the population. And thanks to this program and advocacy at the Bioko population level, people will be able to move forward and organize better than before. What we did not know, they will teach us about it. In addition, the district needs a health center, competent doctors and nurses, and all that is needed to care for people. In this village, there is a center that has not been functioning for 20 years, since long before I was elected mayor.
It is a difficult situation that we have found on the ground and that we really want to improve. We will try to strengthen family planning as well as prenatal control in the health centers covered by the project. And because of the situation we found on the spot, where we see that in the health centers there is a mix of essential functions. Sometimes they give birth, hospitalizations, but they do not do family planning or prenatal control of pregnant women. This is where we want to work. We donated reproductive health kits to several health centers to strengthen the family planning part. We are preparing a training this year for all health professionals, and probably in the coming months we will be distributing family planning methods that are modern and available. We will even introduce methods that the country has never known, such as implants. And with all this, with our constant monitoring, with our agents in the field, we will try to push to strengthen the family planning, which we have seen made less than 3% coverage of this part of the continent. And even at the national level, we only have 10% of women who say that they have seen their family planning needs met. It is an issue of great concerns for us, and we will work to find solutions. Go ahead and organize better. The process is already underway. Women are there, even more numerous, and younger. I have been working in advocacy for a number of years, and I see that it is of an interest to women. But what happens is that women are reluctant to take action, even though they know the importance of family planning. They participate and they do listen, but they do not always have the decision-making power to make the right choice. These are the kinds of problems I encounter. For example, when talking about the methods they have to use as a couple, they're not able to tell their husband, "Darling, I have to do planning because my body has already had several deliveries." They know that it bothers them, but they still support it, and so far there are few who decide to tell their husband. Now that's enough. I have 2 children, a 3-year-old girl and a 2-month-old boy. I'm very interested in family planning because it will allow me to organize my family and my daily chores and my job. At the moment, I do not want to get pregnant anymore. I must lead a quiet life in order to take care of my children and my home. I do not plan to have a child for the moment, and I use the pills to make sure that it doesn't happen.
It is a discussion activity to inform about family planning practice, to avoid the lack of information and unwanted children. We use TV and radio, and community agents carry out outreach activities in the suburbs. Where there is no radio or TV, these agents strengthen our campaigns. This network facilitates access to information. This information is welcome to people because they know they need it to take positive action.
For the government of Equatorial Guinea, these family planning awareness campaigns include a vast program to strengthen the national health system. And from this perspective, high-level meetings are organized to evaluate each phase of implementation.
This is a very important activity for any country because the Ministry of Health needs reliable data to work. It is an ongoing assessment process for the well-being of families. The health sector needs to know the number of children under 5 for better medical coverage. It also makes it possible to know the health status of mothers and children, as well as the prevalence of non-contagious chronic diseases such as hypertension and diabetes. The majority of the rural population suffers from these pathologies, and we want to be able to treat them throughout the territory. We try to know the number of pregnant women and to identify their states of health. We did not have accurate statistics, but now government institutions are looking for reliable metrics for achieving the 2020 targets. Recommendations were provided to government institutions and to the UNFPA so they can expand their activities. The UNFPA has helped us a lot technically. Without them, all this would be very difficult.
La Guinée équatoriale, c'est un pays normalement qui
Equatorial Guinea is a country that normally should be able to provide information on everything that is done there. If there was a little more effort in what I call, for example, improvement of the statistical culture, not only in terms of data production, but also the transformation of data into information so that all actors in development can use them wisely. In general, it has been lacking. So it will not be a question of strengthening the national statistical system so that we can produce all the necessary information in the context of development. This information related to sustainable development, but also it would be necessary for the country to enter a routine for the production of these types of information. Currently, we are in the process of putting ourselves in it because it is important for the different actors.
C'est important pour les différents acteurs.
In the city of Basakato, a few kilometers from Bioko, it's another world. The health center is practically abandoned. There is everything here that the project is looking for in its component of the rehabilitation of the health system in Equatorial Guinea.
We are 5 in the center of Basakato, and we have a problem regarding human resources. We need a doctor, a pediatrician, an intern, a midwife, a lab technician, and a lab expert who will provide efficient work. If we compare with other centers, we are few. We also need training, and we feel marginalized in this world of new technologies. We do not have water, and the laboratory does not work due to lack of means. People rarely come because they know we have few means, and they happen to lose patients for lack of money.
First, I get women who come to humanize their children from 0 to 1 year old, pregnant women and women who have reached fertile age. If others want to control weight and height, I do it for the children from 0 to 5 years old. Adults are also consulted. I get a lot, but not every day. The Maternal and Newborn Mortality Reduction Project of the Equatorial Guinean Ministry, implemented for $6,200,000 by the UNFPA with funding from the oil company Noble Energy, has really started in 2017. We had some startup difficulties, but currently we feel that we are on the right track. With the Minister of Health, we are together on the field, and we see that health professionals expect a lot from this project, and they are proud to see the progress of the activities as well as the expected results. We have 3 basic results. We will work on 3 main pillars to achieve our goal, which is to reduce maternal and neonatal mortality. The first pillar is the training of health professionals. The second pillar is to improve all the infrastructure, give essential medicines that save the lives of mothers and children, including finding the necessary equipment for maternal and neonatal health care. And the third pillar that is related to the health information system. So we want to strengthen the country's health system, especially in the area of maternal and newborn health, the vigilance of maternal death, and thus reduce maternal and neonatal mortality. The project has already made some progress. Here at the Health Center Campo Yonde, the building has already been renovated, equipped and provided with medication. The patients are there in great number.
Los servicios que se prestan aquí son múltiples.
The benefits are many, and for example, we receive pregnant women for prenatal visits, we weigh children in good health, and we do consultations in general. We do pediatrics consultations, we do family planning consultations, we vaccinate children as well. We have a laboratory for analysis and observation room, and a delivery room that is not functional at the moment, but it will be. We have multiple services, but we need training to strengthen our human resources because the majority of the present staff does not have the training required to meet the demand, which is important, and also materials such as family planning instruments and medicines. I come to this center for planning so that I can rest and recover from my past pregnancies and be able to take care of my 7 children. I also have a 15-year-old girl who also needed planning so that she can finish her studies and possibly get to university and have a promising future. I come here every 3 months to get an injection, although there are other methods of contraception. The government of Equatorial Guinea and the UNFPA Regional Office for West and Central Africa welcome initial results in the implementation of the Maternal and Neonatal Mortality Reduction Project with the assistance of Noble Energy.
Our wish is that the private sector, as an actor, can join the traditional donors in partnership with the United Nations Fund so that, in the framework of its pilot operations, the operationalization of the demographic dividend captured that we are launching in 8 countries of the region, and we started with FAS in Senegal, that we can see that we can rely on the private sector to be a good stakeholder. So to this task has this ambition, has this exalting enterprise of working together and investing together to improve people's living conditions. I think the private sector has an extremely important role to play when it comes to capturing the demographic dividend. And that's why I was 1 year ago to contact Global Business Coalition for Help to sign a memorandum of understanding that allowed us today to engage a number of interventions that are exactly in the sense of identifying opportunities such as this partnership with Noble Energy, and for which I think there are many private sector actors who can, with a partnership, help to reduce poverty, disease, and make Africa an emerging continent.
un continent émergent.
Yo califico esta asociación, la califico de muy positiva.
This collaboration is very positive. It is an innovative and unique partnership, as it is the first time that a government, a private sector oil company and a UN agency, in this case the UNFPA, are joining forces to reduce maternal and neonatal mortality in the country.
Para reducir la mortalidad materna y neonatal. We
believe that this type of strategic partnership is the one that best adapts to the realities on the ground and is essential to meet the challenges of the future.
The current experience in Equatorial Guinea presumably contains the beginnings of tomorrow's partnership for the financing of development policies and programs in Africa. It is up to all actors engaged on the ground to pay to it the greatest attention.